Your Excellency Ambassador, ladies and gentlemen, it's a great honor for us, for me, to come here and speak about Kauno Klinikos, and thank you for invitation. And first of all, I would like to thank Swiss Confederation and your government to you for 30 years Swiss support, financial support of our healthcare system, improving maternal and neonatal health. And numbers during these 30 years, decreasing mortality of neonatals, maternal mortality is fantastic. And I understand my speech here as little giving back to you, thanking for your support. And if our experience we will share will be useful, we will be very happy. Some words about Lithuania. It's a small country near Baltic Sea. We have only 2.8 million people living here. Kaunas is the second city in Lithuania. It's located in the middle of the country. Our university hospital was built 1936, was beginning of construction, and the hospital was built for the university as a teaching hospital. Kaunas at that time was temporary capital of Lithuania because Vilnius was part of Poland, and Lithuanian University was working in Kaunas, and they decided at that time to build a hospital for teaching purposes. And now we have two founders, Lithuanian University of Health Sciences and Ministry of Health of Lithuania. I have a small team of deputy directors, and maybe it's worth to mention that we 4 or 5 are medical doctors. I am cardiologist, Thomas also is a cardiologist, and every day I'm going to outpatient department or echo lab to do some echo exams for patients. It's very useful to me to know real life what is going in our hospital. Some words about our university, a specialized university with 2 academies, Medical Academy and Academy of Veterinary Medicine. In Lithuania we have only 2 medical faculties, one in Vilnius, second in Kaunas. And our hospital is a campus-like hospital. Many buildings were built after the beginning of our hospital. And hospital is a specialty-based departments hospital. We have 38 different specialty-based departments and 5 affiliated hospitals in our structure. We have strategy where 5 areas are very important. Of course, improving healthcare, research and studies because of university hospital, our employees, motivation of them, and of course effective management because even richest countries, even United States, it was mentioned before, we all don't have enough money for healthcare, and in the future also will be the same. because of elderly population, because innovations are coming every day, every year, every month, and individualized medicine will come and will be very expensive, and we should work more efficiently to save money for these innovations of the future. And because of our neighbors of Lithuania, we should be more threat resistant, and now we are working to build underground facilities serving as also for military purposes. Our priority areas in Lithuania, cardiovascular mortality, cardiovascular diseases are most important killer, and also cancers. Being university hospital is important for us. Genetics, modern medicine, transplantations, rare diseases are most important priorities for us. About numbers, our hospital is largest in Lithuania, but not only Lithuania, also in Baltic countries, in Latvia and Estonia. We are second employee in Lithuania. We have more than 8,000 employees working in the hospital. And what we are doing a year, 1.5 million outpatients visits, near 100,000 hospitalizations, 77,000 different operations, a lot of heavy imaging techniques we are doing for our patients, because we need a lot of them. All sorts of transplantations we are performing in our hospital, and numbers are increasing. Rare diseases is maybe one of the places where we can collaborate internationally between the hospitals, and we are part of European rare disease networks. In 5 cases, full member. In 10 cases, affiliated member of European rare disease networks. And why we are here to talk about our digital system, and to talk what we can get from these systems back, working with efficiency of the hospital, improving our healthcare, improving quality of our healthcare. First, quality of healthcare is very important. Adverse events, and as we all know, not easy to report adverse event in the hospital. We are not willing to share our mistakes with colleagues. It's not easy to do this, and because we have a digital system, we are using now artificial intelligence tools to extract from all cases we are treating now in the hospital something suspicious. We have adverse event. For example, after operation, patients are using antibiotics, or we have some signs in digital recordings, the patient has falls. And numbers of adverse events we can find with artificial intelligence increase in times. Not only in percentage, but in times, maybe 5-10 times more than doctors are reporting. And it's a very useful tool for administration to talk with departments how we can improve, how we can avoid these mistakes, these adverse events. Satisfaction of the patients is also important. Every door of our outpatients room or patient's room in inpatient department has barcodes, and patient can report what is wrong, what we can improve, and the duty of our managers to read, to analyze this data, and make changes. for our patients. For changes, it's important support from our staff, from our managers, because as a physician, as a doctor, being taught by universities, understand before that our goal is to diagnose and to treat the patients in the best way, and that is coding, finances, procurements. It's not our duty as a physicians. It's administrative. It's their job. And please provide for us all we need, and we will be happy, and we will serve for patients. And what we are doing to teach our doctors, our managers, our nurses managers, we have managerial school of Kauno Klinikos for 7 years. We are going outside for the weekends and learning together with our team soft managerial things, how to improve our work. Leaders Academy, we have now second term. New Leaders Academy is our duty for future generations of our managers, of our rectors, ministers, maybe. And it's a very successful project we are running, and very important being university hospital. How we are evaluating how successful we are as a managerial team of the hospitals. Salaries of physicians and nurses are good indicator for us, because our goal is to increase salaries because of competition in Lithuania, because of migration of our doctors to other countries, and now we have possibility to increase our salaries, and we are happy that migration of doctors now stopped, and many of them are coming back from UK, from other countries. They were working as a physicians, and our budget is 360 million. It's not huge in European aspects, but we have what we have. About digital systems, starting from 2015, we have a hospital information system, and we have connections with national health system, with sick funds system, transferring data about coding. And in hospital we have 50 IT guys and ladies who are working with improving our system. Our system now is more than 10 years old, Estonian-based system, not Epic. You don't have money for Epic, but what is good that we can improve by ourselves, and improve every year, every month what we need, and we can extract data from the systems what we need to have for managers, managerial purposes, also for research. We have medical students, and they are doing some research during their studies, and now we are helping for them to collect digital data, what they want to study, and to investigate. It's very easy, half an hour, and our student has a collection he want to investigate. About quality, because we have national system, our IT people is allowed to join to national registers and to extract data. For example, that occurs not in the hospital but after, and in this case we can have quality indicators like 1 year mortality after stroke, and it's very important because we are looking at the efficiency. It's very easy to skip quality or to reduce quality, and it's very important to have not only efficiency related indicators but also quality indicators. And now we are working hardly to have for all clinical departments important outcomes indicators. Operative rooms are very expensive in every hospital because we are doing a lot of surgeries, working in more than 80 operative rooms. It's very important to work efficiently, and we have system. Our anesthesiologists are reporting when they are starting, when they are ending with operation, and we are calculating efficiency coefficients, and after that we are making some financial incentives for heads of the departments who are working very, very efficiently. I will later talk about that a little bit. Dashboards, it's important transparency in huge hospital because to say some not nice words for heads of the departments is not easy for directors. But you can use digital tools, letting them to compare. For example, surgical departments can compare their efficiency, how efficiently they are using operative rooms. And nobody wants to be on the bottom. And it works. It works. We have a lot of data allowing to us to look at how our departments are working. We are calculating for each clinical department's income, expenses, and calculating profitability, dynamic of profitability, and profit for one physician and how it's changing. And this is very important. You know, we are not for-profit hospital, we are public institution, but we understand that we are dealing with public money, and we should work very efficiently spending this our people money. And having digital systems, now we have several years, we have tools giving some financial incentives for our doctors and nurses. Part of some amount we are getting from sick funds, we are giving to our physicians and nurses, for example, for outpatient consultations, for rare diseases, for daycare, for radiological exams, for emergency services, also for inpatients care. Our system can extract data for every physician, how much is he or she is doing every month, every quarter, and according to this, we are paying some money, adding to fixed amount of salary to doctors and physicians. And pressing our clinical leaders, heads of the departments, to take more attention on these managerial things, on efficiency. We also paying some financial bonuses if they have very good result working with what they have planned for outpatients, what they have planned for inpatients, but also looking at the changes of profitability. Not at the profitability, but at the dynamic of the profitability, because this is more important making changes. About new technologies, maybe you are all familiar, but just to imagine what we are. We have very strong radiotherapy at our hospital. We have cyclotron, now only one in Lithuania, producing FDG, a biobank because of university hospital together with the university, and these biobank data also are connected with digital data of each patient, and having collection, it's very easy to follow this patients, how he or she is living after operation, for example, after 1 or 2 years. Modern Children Rehabilitation Department opened last year, and last our project we are approaching to finish this year. This is infectious disease hospital. It's pandemic lessons. It's autonomic hospital inside of our campus, having intensive care unit, diagnostics, outpatient departments for infective diseased patient. And thank you for your attention.